Assalamualaikum and a very good morning to the honorable panels, professors, doctors, lecturers, and to all dental students. I am Anisya Hanum, and along with me, Farah Hanani, would like to present our elective research project with the title Parents' Awareness of Sugar Consumption and Oral Healthcare of Preschoolers in Sungai Buloh.
Okay, for our background, according to Government of Malaysia's official gateway, preschoolers in Malaysia are children aged from 4 to 6 that begin their education formally as a preparation before entering school system. Children at this age may prompt more sugar cravings when they are growing. They tend to consume a large amount of sugar from their foods and drinks. Based on American Journal Clinical Nutrition, sugar consumption is normally consumed in form of monosaccharides and disaccharides. Meanwhile, oral health care is the practice of keeping the mouth clean and healthy by brushing and flossing to prevent tooth decay and gum disease. According to American Psychological Association, socioeconomic status is the social standing of class of an individual or group. It is often measured as a combination of education, income, and occupation. In Malaysia, the names B40, M40, and 220 represent percentage of the country's population of bottom 40%, middle 40%, and top 20% respectively. The B40 group has been categorized as the lowest household income group. Okay, from the previous study, there was a relation between awareness level of socioeconomic status of the parents and, and the awareness level. But in Malaysia, data on the parents' awareness of sugar consumption and oral health care among preschoolers is limited. Hence, the rationale of the study is to evaluate parent awareness of sugar consumption and oral health care of preschooler, specifically in Sungai Buloh, Selangor. Okay, our first objective is to investigate the parents' awareness of sugar consumption and oral health care of the preschoolers, and second, to examine the association between parents' socioeconomic status and the awareness level.
As for the methodology, this was a cross-sectional questionnaire study, a cluster randomized controlled trial investigating parents' awareness level in Sungai Buloh with a total sample of 361. Baseline data collection was conducted between November 2020 to February 2021. Parents that included in the study are parents of the preschooler age between 4 to 6 years old in Sungai Buloh. The selected parents are contacted by the preschool principal via their respective group in WhatsApp. They completed a 4-page questionnaire via Google Form. It consists of consent form, demographic data, and 2 other domains, which are sugar consumption and oral healthcare for preschooler. Questionnaire were provided in both English and Malay. For assessment, it consisted of 20 questions on 3-point answer. Score for each correct answer is 2, incorrect answer is 1, and have no idea is 0. Score lower than 13 denoted as low, between 40 to 27 as average, and above 28 as high. Our first objective was analyzed by descriptive analysis, and second objective by Pearson correlation. This study has received ethics approval from British Ethics Committee University Technology Mara on 30th March. As for the result, the study included 126 parents who completed the study questionnaire. Parents each range from 24 to 50 years old with a mean age of 36. The majority of the respondents were 88.1% females and 100% Malay. The overall mean score from this questionnaire is 31.87 score out of 40. The highest score from the questionnaire was regarding the effectiveness of fluoridation to the teeth, the importance of oral health as the health of other parts of the body, and children who sleep with a bottle containing milk can cause cavities. Majority of the parents answer incorrectly or not aware of are regarding brushing their child teeth after every meal, eating 5 chocolate in one go is better than eating in small amount but intermittently, and sticky sugary foods are more harmful to the teeth than sugary drinks. By using Pearson chi-square test, there are significant association between socioeconomic of parents with several questions from the awareness score, as P is less than 0.05. The questions are regarding food and drinks that can cause caries formation, sugar content in sweetened drinks, food labeling, the effectiveness of fluoride on teeth, daily frequency of brushing teeth, treatment available for children with caries, and importance of oral health. From this Pearson chi-square test, results show that those with high income have more awareness compared to the other groups. One with ANOVA test revealed that there is a slight difference between the group but not significant in the mean score. the mean of awareness level of the parents in Sungai Buloh. SP is equal to 0.089 as shown in the table. We observe the T20 group has the highest mean score compared to the other two groups.
This study focused on investigating parents' awareness of sugar consumption and oral health care of the preschoolers in Sungai Buloh and addressed a gap in understanding and association of socioeconomic status of the parents with the awareness level score. Based on statistical analysis, parents' knowledge on both domains is a crucial factor and a good determinant that influence their children's dietary intake and oral health care among the three groups of socioeconomic. Our respondents were 100% Malay. Based on Department of Statistics Malaysia 2010, majority of population in Sungai Buloh are Malay and Bumiputra. As mentioned earlier, the age of our respondent was 36 years old. Stephen et al. 2005 stated that Generation X consisted of those born between 1961 and 1981 are more productive, more motivated, and easily trainable compared to baby boomers. Statista Research Department 2017 stated that Generation X global mobile internet usage rate is second highest, only behind millennials usage rate. 68.1% of our respondents were female. According to research, both males and females provide parental care. However, females are primary caregivers. Women tend to more concerned than men with monitoring good relationship with their family and friends. There was also significant relation between the mother's oral health education and skills toward their children. From the assessment, we observed that those who have good level of education who access additional nutritional knowledge and information, thus favoring healthy food and being aware about their daily sugary consumption. Apart from that, the parents also may be educated from the advertisement of toothpaste, social media, or reading. Those who lack awareness was usually people who have lack expense. Food with poor nutritional value and higher sugar consumption cost less per calorie and tend to be selected by groups of lower socioeconomic status. Other than that, the misconception may result from inaccuracy information in public awareness. The association between household income and the awareness level presented varied pattern. Different factors may explain this association. Inaccessibility or inaccuracy of information and those who were lower income could be the causes of the lack of awareness among the respondents. Inequalities were observed. Females and those who were higher education level were more likely to have high awareness. For our study limitation, this study was conducted online instead of face-to-face due to COVID-19 pandemic. Hence, got low response rates. The parents could access to the internet while answering the survey. Repeated requests to accomplish the survey given due to low respondent may be perceived by the respondent as bothersome. And last but not least, limited internet access for some parents.
So in conclusion, the parents' awareness of sugar consumption and oral health care of their children in Sungai Buloh was high. The socioeconomic status of the parents does influence the awareness level, but the mean score was not significant because of insufficient sample size. However, our study did not examine the relationship between the parents' awareness level with the oral health status and the prevalence of endocarditis among preschoolers. So as recommendation, we would like to suggest a further study or relation between parent awareness level and the oral health status and dental caries prevalence in preschoolers. That's all from us. Thank you for your kind attention.